no longer provide insurance for my employees.
Yeah.
Small businesses have been asking for this for years. It's not a new idea.
Right.
They've been asking for it for years, and we think it's a far better way to get these economies of scale than the exchange thing that's in the huge bill. This will actually allow businesses to be able to lower their costs exactly the same way that large businesses do.
Okay. Max is going to go, and then I'll go to you, Rob. Max, do you want to address this issue of how we can allow people to buy into large groups, how the Senate bill accomplishes it, and I don't know if you want to remark on what John just said.
Yeah, well, absolutely. I'd go first like to say something that just strikes me just in spades. Frankly, we all studied this issue a lot, healthcare reform. We basically know what the problems are, all of us. We basically know the current system is unsustainable. We are actually quite close. There's not a lot of difference. Close in the sense, without being corny and dramatic about this, that the American people want us to do something that's basically reasonable. Doesn't have to be one congressman, one senator's provision, but basically reasonable. We are on the verge and the cusp with not too much effort to try to bridge a lot of gaps here, because the gaps in my judgment are not that great. Let's take the list, for example, that Lamar mentioned. As you said, Mr. President, we are basically including most of those provisions, if not all, in our joint legislation. Selling insurance across state lines, for example. We allow for that, not exactly in the way that some would, but sure, with compacts. And once the state exchanges are up, people will be able to buy and sell insurance across state lines and achieve that competition. In addition, you mentioned lawsuits. Secretary Sebelius is working to try to find ways to encourage states to settle, resolve issues before they become big bad lawsuits. Add to that, Lamar says we should find ways for states to be able to lower their costs, so we do that. We let states opt out. They can do what they want to do. And Senator Wyden also has a proposal. Senator Cantwell has a proposal. We give a lot of flexibility in that regard. Expand HSAs. That's fine. There's nothing wrong with HSAs. But we also have to have products for poorer people, lower income people. HSAs work pretty well if you have middle or high income. Pre-existing conditions, clearly, we all agree on that. We have those provisions in our bill. Respect to small business, we're not that far apart. Some suggest association health plans, where small business people can band together in an association pool and get better insurance. That's fine. What we provide for in our legislation is something similar. It's called the SHOP Act. Various senators, bipartisan, have worked on this. And basically it allows, sets up a small business arrangement in exchanges. Small business participates in their own exchange and gets the advantage of all the pooling. And then they can do what federal employees do today. They can shop and compare and to get the best deal. And I would guess that most small businessmen would like to do that. I might add that we're also providing tax incentives, tax credits for businesses, small business, that wants to purchase health insurance for its employees. And it's pretty good. It's 35% tax credit first couple of years. Then once the exchange is up, it's 50%. So the main point is we're not really that far apart. We're trying to find ways for small business to pool, small business to take advantage of competition, to shop and compare. Also some tax provisions that to encourage businesses to get health insurance. So I might say too that if you look at all the provisions that Stanley outlined, many of them, we agree on prevention. There are major prevention provisions in our legislation, as Senator Coburn mentioned. We also agree on trying to change the way we reimburse docs. I think the biggest game changer here, frankly, is how we reimburse our doctors. They're based more on quality rather than quantity. I know Tom Coburn really agrees with that as a doctor. And most doctors do. And it's another example we really are close. And I think that once we keep pushing on those areas that we're close, it's going to make a difference. The exchanges, as you mentioned, Mr. President, it's a Republican idea. It works. What I like about exchange, it's like Orbitz. It's like Expedia. You go to Orbitz or Expedia to buy an airline ticket, you compare it, get the best price. That's basically what this is. It's an exchange. You go to the exchange, you shop around, and you get your best price. That's going to help, in my judgment. I also think that we should, where the hospitals should publish the cost of their basic procedures, whether it's appendectomy or colonoscopy or whatnot, to enable consumers to shop around. Where's the best price? We all know that there's a wide disparity in what hospitals charge for the same procedures. I think disinfectant of sunshine helps. It helps consumers. It helps our people. And fraud and waste, we've talked about that. We have major provisions in our bill to fraud and waste. Mr. President, I compliment you because in your proposal you go even farther.
We took some additional ideas from folks like Congressman Ross.
They're great ideas. And we address the unnecessary readmission rates, hospitals, etc. The main point is we basically agree. There's not a lot of difference here. And I just like us to kind of just, there's an opportunity for us to work out some of these differences.
Mitch, is there somebody?
Mr. President, I'm going to yield to John here.
John?
I'd like to yield to Dave Kemp to continue this conversation about cost containment.
Dave?
Thank you, Leader Boehner. Thank you, Leader Boehner, and thank you, Mr. President, for the invitation today. I think as we focus this part of the conversation on cost, a lot of Americans say to me, if you're really interested in controlling costs, well, maybe you shouldn't be spending $1 trillion on health care, as the Senate and House bills do. Also, cutting Medicare benefits by $500 billion to fund this new entitlement is, I think, a step in the wrong direction, and many Americans do as well. The nonpartisan actuaries at the Center for Medicare and Medicaid Services say on page 4 of their letter on the Senate-passed bill that it would bend the cost curve in the wrong direction by about $250 billion. They specifically say the health expenditures under the Senate bill would increase by $222 billion. A key way of reducing costs that's missing from the House and Senate bills is responsible lawsuit reform that guarantees injured parties, much like our two largest states have adopted, Texas and California, access to all economic damages, such as future medical care. If they need nursing care in the future, they'll get it. Lost wages, reasonable awards for punitive damages and pain and suffering. On page 4 of its letter to Senator Hatch, CBO found that this common sense reform would reduce the federal deficit by more than $50 billion. Now that's just on the government side, because as we know, CBO doesn't score the private side on this. And PricewaterhouseCoopers has done a study that said savings could be as high as $239 billion if this reform were adopted. There are two features in the House and Senate bills that move in the wrong direction. Both bills feature restrictions on health spending accounts where people can save tax-free for their health care, as well as FSAs, flexible spending accounts. These changes are such as they ban the use of over-the-counter medication out of both of these plans. There's a new cap on FSA contributions of $2,500. That text, that language is found on page 1959 of the Senate bill. And that will hinder the growth of those plans, and which encourage Americans to consider quality and price when they purchase health care. And let me just say, under HSA plans, premiums increased just 1.3% for individuals in 2007 to 2008 and declined 5.4% for families in that same period. And when people switch from a PPO, a preferred provider organization, to a health savings account, their premiums decline by an average of $3,800. Now, another concern I have is the Senate bill, which on page 982 creates an unelected board charged with recommending even more Medicare reductions. And if Congress doesn't accept these recommendations, they have to find other Medicare spending to cut instead. And that gives, I think, too much authority to unelected bureaucrats rather than to elected representatives of the people. And the power to decide whether to cut Medicare and by how much. Now, holding down health care costs for the government is important, but I think it's also important to hold down costs for families.